Hi, I'm Craig Stern from Pharma Pharmaceutical Consultants. We've been talking about multiple topics and especially about formularies. And on our last conversation, we spoke about what's a formulary, how do you structure it, what are the formulas for putting it together. And what was notable there was that there were multiple ways to structure a formulary, but especially because you want to look at the population, identify what's the demographics, the age and gender, what is the disease pattern of the population, and then having given that, how do you determine what drugs you're going to include or exclude? And we talked about the fact that different formularies include or exclude multiple drugs, but that all formularies in general have to have certain kinds of drugs because there are certain diseases that are endemic in the general population. What I'd like to talk about today is types of formularies. And this is a very large topic unto itself. We'll try and make it a little bit more limited, but let me address general formulary types. And that is, number one, you can have a totally open formulary, which means that you include every possible drug that is available. The rationale for this is to make sure that people have complete access. You don't want to limit any access to them about any part of a formulary. The second type is that you can have a restricted or a closed formulary, and the closed formulary restricts to just the certain drugs that you want to include. And the rationale for that is that you may have a very closed network of people that are patients here and that they have only specific diseases and there's no rationale in expanding beyond that. Or that there is a limited money to pay, and therefore you want to really restrict down to the lowest cost agents within each category. A third way to deal with this is what we call a truly closed formulary, and in that regard it's not restricted, it's totally closed, and it is kind of taking the restricted concept to its very extreme and closing it so that only certain drugs, certain types of drugs, certain dosage forms of drugs within those categories can be included. Now, if you have that, then the question is why would I want to use one or the other? How do I use one and the other? Because all of these exist within the general environment in multiple different health plans. But I'd also like to point out to you that there are multiple variations to each one of the things I've talked about. For example, you can have an open formulary, and that open formulary means that you're covering general drugs, but at the same time you have what's called a preferred drug list, and that preferred drug list is set up so that of everything you prefer certain ones. Now, how do you make some sense out of that? How does a patient make sense out of that? How does a doctor make sense out of that? Frequently, but to be honest with you, it's very complicated. But what isn't complicated when you do that is to say, well, if you give certain copays to the preferred drugs, and in fact, for example, they pay $10 in copay for a generic, let's say they pay $20 in copay for a brand, those are for the preferred, but if it's for the non-preferred, then you find that they're paying perhaps double that. They're paying $20 for a generic, and they're paying $40, $45 or more for a non-preferred brand. So you can limit this kind of information. This is a very broad topic. There's a lot of elements to it, but it brings up several other things that we're going to be talking about. Now, I am going to go back to the formulary concept, but it brings up several issues with regard to selection of drugs, further types of formularies, rebates, and a host of other issues with regard to copays. This is a very quick introduction, but I want to make this as simple as possible for an audience that doesn't have to live with this every day and wants to understand it. I look forward to speaking with you again. Have an outstanding day.